There has been little activity on the streets in the urban centers since Pakistan announced a lockdown 3 weeks ago over the fear of surge in coronavirus cases. However, the poor people defy lockdown every day in search of some work. Many of them rely on public handouts. The government is paying $80 to each of nearly 3 million poor families. However, not everyone among them is getting essential food supplies and financial help they need.
We have two options, either to die in our homes with hunger or come out and die with coronavirus. Ultimately, we have to face death in whatever form it may be, but we cannot see our hungry children at our homes.
100 have died of coronavirus in Pakistan, while nearly 6,000 have been quarantined after they tested positive. About 1,400 patients have recovered from the COVID-19 so far. After 2 days of consultations, Prime Minister Imran Khan extended the lockdown for the next 2 weeks. However, as 25% people are living below the poverty line, the government has relaxed restrictions on construction industry and agriculture sector to help the most vulnerable segment of the society. Many trade associations have demanded similar concessions and have vowed to reopen their business in defiance of official restrictions. In several other cases, the food supplies were looted.
Our biggest worry now is people dying of hunger. So the dilemma, on one side, stopping people dying from the virus, on the other hand, preventing deaths from hunger as a result of the lockdown. We do not have the money to spend on already the overstretched health services.
Many medical experts believe the reason coronavirus has not hit hard Pakistani citizens is because of their genetically strong immune system. However, Prime Minister Imran Khan has warned general public and medical experts not to draw a premature conclusion, as the real scale of the spread of the deadly virus has yet to be fully unfold.
Well, welcome you both. JAVED Rana, first to you. Still promising signs in the fact that this has not spread as badly as some other countries, in some other countries. Tell us how Pakistan has been dealing with this, and perhaps reasons behind this not spreading as fast as other cases.
Well, the response from the government of Pakistan was belated, but finally they did come into action, and as a result of which we have now seen that there are nearly 6,000 people who have tested positive, and around 100 people have died. But very importantly and very remarkably, I would say that as many as 1,400 people have recovered. That is astonishing figures for the medical scientists, but that is what it is. I think these are some of the reasons which actually led Prime Minister Imran Khan to soften the lockdown. Now, that is the reason that we have seen now that he has come up with a policy whereby the construction industry is going to be allowed, agriculture sector is going to be allowed, and there are also reports that probably some of the other sectors which involve these labor workers, they would also be allowed to work. But there is a bigger problem, and the bigger problem is that the small traders, particularly in the southwest of Pakistan, in the southern region of Pakistan, they sounded very defiant. They are saying that from tomorrow onwards, they are going to defy the lockdown and they are going to reopen their shops. And that is a part of the problem, something government doesn't want it. Now, Pakistan is basically sandwiched between poverty and the threat about the surge of this coronavirus cases. So because of these reasons, we have seen today's announcement by the government of Pakistan, but it is a bumpy road that Pakistan. Prime Minister has warned the people that because in general there is a perception in Pakistan that since there is a strong immune system that Pakistan is, so this coronavirus is not going to touch them. Prime Minister has warned that we don't know what is going to be the shape of the situation after 3 weeks, after 4 weeks. Now Pakistan is testing more than 20,000 people every day. And if this testing, the scale of the testing is expanded, there is a possibility that the more people would come into this fold. But we have to see the very nature of Pakistani society. They believe in their faith. They believe that they cannot stop death from happening. but generally they are having a traditional diet system, because of which I think their immune system is strong. And some medical scientists are saying here that the coronavirus is not exactly the same virus that we have seen in West and in China. It has mutated, it has changed its form, and that is why it is the less aggressive in Pakistan as compared to the rest of the world. But again, this is also a fact, by the way, that the immune system gets maximum strength from the psychological makeup of an individual, and the strength that Pakistani are getting largely they're getting from Islam, which instructs them, which tells them that you cannot stop death from happening. But again, Islam also teaches them that there has to be precautions, and that is where people of Pakistan are lacking.